Assalamu alaikum wa rahmatullah. This is Dr. Hoda Fathi presenting lecture number 10, the course entitled Drug Awareness. In this lecture, we are going to continue discussing drug of abuse. Let's discuss hallucinogenics. In his search for food, early man tried all kinds of plants. He was only trying to find something to eat. Some nourished him, some cured his ills, and some killed him. A few plants, to his surprise, had strange effects on his mind and body, seeming to carry him into other worlds. We call these plants hallucinogens. Why? Because they distort the senses. They usually produce hallucination experience that depart from reality. Although most hallucinations are visual, they may also involve the senses of hearing, touch, smell, or taste, and occasionally several senses simultaneously are involved. يعني كان الإنسان الأول بيحاول إن هو يلاقي حاجة ياكلها يا إما بتجربته بنفسه أو كان مثلا بيتتبع حيوانات ويشوفها بتعمل إيه فلقى طبعا نباتات كتير بتنفع كغذاء بعضهم كان بينفع كدواء والبعض الآخر لما جربوا تسبب في مقتله لكن كان في بعض النباتات يعني كانت عنصر مفاجأة بالنسبة له إن يلاقيها لها تأثير غريب قوي على المخ عامة. إيه اللي كان بيحصل؟ إنه كان بيسبب له نوع من أنواع الهلوسة. الهلوسة دي غالبًا بتبقى بتتأثّر البصر بيتأثّر بيها أو visual وأحيانًا تشمل حاجات تانية زي مثلًا السمع أو الtaste. How can we classify hallucinogens? We have four types of or four classes of hallucinogens. The first one, serotonergic hallucinogens. They are chemically similar to serotonin. Serotonin is a neurotransmitter in the brain. Second is methylated amphetamine. They are chemically similar to norepinephrine. They cause alteration in mood without much change in senses. As we all know, norepinephrine or adrenaline is the compound responsible for preparing your body to either attack or run from any stress condition. Third class is anticholinergic, and these compounds are found in solanaceous plants such as belladonna and datura. They cause a dream-like state. And the final class is dissociative anesthetic, and these are compounds taken before surgery so the patient can remain conscious. They cause euphoria or sense of well being, numbness, aggressive behavior, and tactile sense disturbances. Let's start by serotonergic hallucinogen. We have two compounds lysergic acid diethylamide, which is well known as LSD. It is based on a molecule found in the ergot fungus. Dimethyltryptamine, known as DMT, and it can be found in many mammalian or plants, such as Virola trees. Methylated amphetamine, on the other way, include two main drugs MDMA, known as ecstasy, it is a synthetic compound, and MGA, known as love drug, which is also a synthetic compound. MDMA or ecstasy, here we can find its structure, chemical structure. Of course, we are not going to study its chemical structure. And up in the picture, you can see many forms of the tablet. All these tablets are street tablets. They are not synthesized by any authorized pharmaceutical company. They are street drugs. Concerning the pharmacology and history of ecstasy, in the street market name or slang in Egypt, it is called al-khat or al-pillet. MDMA is a purely synthetic norepinephrine related hallucinogenic drug. It is very dangerous, as we can see. At least 68 deaths have been attributed to the use of MDMA in the year 1997, mostly from symptoms resembling heat stroke. Why it was synthesized? It was first synthesized in Germany in 1914 first used in 1970s in the US as an adjunct to psychotherapy. Why? Because after any war, the soldiers who come from war suffer from trauma from what he has seen or experienced in the war, from violence and seeing their colleague who are killed or lost an organ, for example, or a limb or a hand or something like that. So they come in a state of mind who needs real psychotherapy. These drugs were used to enhance empathy and communication, induce positive mood states and feeling of intimacy and tranquility. But unfortunately, at the same time, animal studies showed it produced permanent brain damage. It was very popular with young people since the late 1980s. زي أي دراج بيبتدي دايما بداية كويسة في الطب. يعني ده كان الناس اللي هي راجعة من الحروب دايما بتلاقيها بتعاني من حالة صعبة كده نفسيا، لأنها طبعا شافت أهوال الحرب وزمايلها وهي بتموت أو بتفقد عضو من أعضائها، والعنف اللي هم شافوه بيرجع دايما في حالة منعزلة ومتأثر جدا. فالأدوية دي كانت بتساعده إن هو يحس بأنواع من أنواع التعاطف أو تحسن في المود، لكن للأسف الشديد كان ليها تأثير قوي جدا على البرين. وزي أي دراج بيبتدي في الميديسينال بيبتدي على طول parallelly used in the street. About the chronic use or the addiction of MDMA, what can it cause to the body of the addict patient? By chronic use here, we mean someone who is taking MDMA for a long period of time. Signs and symptoms of MDMA chronic use include muscle tension and aches, jaw clenching, as we can see the picture here at the right, the picture of the man after the intake of MDMA, and at the left, it's his normal state. We can see that the jaw has lost a lot of its lipid. Also, the mouth can lose its lipids, and it is called the meth mouth because it is very thin. It lost most of the lipid, including in the tissues. I have said muscle tension, aches, jaw clenching, meth mouth. He also can suffer from facial lesion, fatigue, sweating. These are the apparent signs. What about its effect on the mind? The patient suffers from difficulty concentrating and retaining newly learned material, and this is quite obvious in the students. Confusion or delirium even weeks after drug use. So the addict doesn't have to wait much for this effect to show. Even weeks after drug use, he can suffer from difficulty concentrating. يعني هنا بنقول إن الأعراض بتاعة إدمانه أو تعاطيه لمدة طويلة، مش من جرعة واحدة، من مدة طويلة، ممكن بيسبب إن الدهون اللي موجودة في الوجه تبتدي تفقد، وبالتالي بيبقى الخد بيبقى زي ما تكون متاكل كده لجوه أو رفع قوي، وكذلك الماوث بيرفع قوي، بيبان فيه زي بقعة على وجهه. وأكتر تأثير مدمر بيبقى على البرين لأن الذاكرة بتتأثر جدا، ما بيقدرش يفتكر أي حاجة هو لسه متعلمها، والإفكت ده للأسف بيبان مجرد أسابيع من مجرد أول استخدام. What about the serious adverse effect of the large dose intaken? Here we are going to talk about the acute cases or the large doses or the overdose. Serious illness and death have occurred from dehydration, hyperthermia, cardiac arrhythmia, hypertensive crisis, acute renal failure, and hepatic toxicity. If the patient consumes a large dose, he is going to suffer from dehydration. As I've already said, its structure resembles that of adrenaline, and we all know that adrenaline causes increase in the heartbeat, increase in the blood pressure, and increase in the body temperature. So MDMA can cause the same symptoms: dehydration, hyperthermia, cardiac arrhythmia, hypertensive crisis, and acute renal and hepatic toxicity. Let's focus on this picture. On the right side, we can see the brain after use of ecstasy. On the left side, normal brain. This picture is taken using special techniques that we can see the receptor of serotonin in the brain. On the right side belonged to an individual who used ecstasy many times but had not used any drugs in the last 3 weeks. So you can see the effect is quite quick and the brain is totally affected by MDMA. The bright red spots on the left uh, uh, reflect a normal brain scan where serotonin receptor sites are very obvious. The dark spot at the top of the right scan are serotonin receptor sites which are not active. LSD is known is quite known drug اللي هو عقار الهلوسة lysergic acid diethylamide. Its street name is acid or acido. It was discovered in 1938, manufactured from lysergic acid. What is the lysergic acid? It is a compound found in ergot. Ergot is a fungus that attack the rye plant or other grains. It causes ergotism. This is a quite dangerous disease where a person can lose a limb or a finger because of this ergot. Ergot cause vasoconstriction, so it causes gangrene in the limbs, and he can lose a finger or a hand or a limb. Lysergic acid is one of the components of this fungus, and scientists came up with lysergic acid diethylamide by a simple reaction. It is not considered an addictive drug. Why? Because it does not produce compulsive drug seeking behavior. So, according to the definition, addictive means that the patient must seek for the drug to take it بصفة يعني مستمرة. لما بيدور على الدرج عشان ياخده ده بسميه إن هو إدمان. يعني كتعريف علميا ما بقدرش أقول عليه addictive. ده مش معناه إن هو مش خطر، لأ، بس هو مجرد إن عشان أقول على الدرج إن هو البني آدم ده أدمنه يبقى لازم إن هو بعد أول جرعة أو تاني جرعة بيبقى محتاج ياخد جرعة تانية. لأ، هنا عقار الهلوسة الواحد ممكن بياخد التجربة بتاعته وبعدين بيقعد شهور من غير ما ياخد حاجة تانية. بس إحنا still بنتكلم على خطورته لأن له خطورة جدًا حتى لو هي مش apparent، حتى لو أنت مش شايفها دلوقتي، لكن هو له effect على الbrain حتى لو أنت مش ملاحظها من برّه. زي كده أشبّه لك مرض السرطان، هل أنت الجسم من برّه باين إن المريض ده بيعاني من السرطان؟ لأ. بالضبط، أي واحد بياخد حاجة من عقارات الإدمان دي ممكن إن هو التأثير مش باين عليه من برّه، لكن بدأ already تأثيره على الجسم. So what I was saying is that its intake for one time doesn't really appear on the physical appearance of the patient. That doesn't mean that the body is not affected. Well, no, it is well affected in the brain, but it is not really apparent physically on the patient. When a patient consume LSD, he is suffering or experiencing a trip. Users refer to their experience as a trip. It can be a good one or a bad one. Bad trip, it means that it is horrifying, scary, or he got a lot of tense in his trip. It is a very long trip, can reach about 12 hours. Bad trip when subject experience feeling, as I said, of despair, fear of death, and of insanity. A good trip, of course, can be some colors or a euphoria, a feeling of well-being, something like that. يبقى المتعاطي هنا بيحس بتجربة. التجربة دي بتبقى طويلة، ممكن توصل 12 ساعة، خصوصًا إنه بيأثّر على إحساسه بالوقت، فكمان بتبقى أطول له من ال12 ساعة. ممكن تبقى good trip بيشوف شوية ألوان، حاجات قدّامه مش حقيقية، كلّها بتبقى including في إحساس بالسعادة. لكن ممكن تبقى bad trip بيبقى خوف وقلق وتوتر، هي دي اللي بيسموها bad trip يعني. ليه بقى هي خطر؟ Why is it dangerous? As I already told you, it is not addictive, but still we are going to insist that it is totally dangerous. We stated that it is not apparent physically, but it begin its effect on your body immediately. It can cause trouble sleeping, seizure, and loss of appetite. The long-term uses change the chemistry of the brain, especially hallucinogen persisting perception disorder. This is a very serious disorder. It is associated with most of hallucinogens, where subject experience flashback of his previous trips. So if the subject has experienced a bad trip, is going to suffer from it even years after use, even if he stops using it at all. He is going to suffer from a HPPD case where he can see again flashback of what he has already seen from taking LSD. يعني المريض حتى لو وقف بيفضل ممكن بعدها بسنوات يبتدي يجيله فلاش باك من كل تريبس اللي خدها قبل كده. ودي طبعا حاجة بتأثر على البرين، ممكن إن هو يخليه يحصل له مشاكل في النوم أو تشنجات، وطبعا أسهلهم اللي هي loss of appetite. ودي الحالة دي الحقيقة مش بس مع ال LSD، كتير من الحاجات المهلوسة بيفضل المريض بيعاني من أثرها حتى لو تعافى تماما، بتفضل برضه تجيله الذكريات بتاعة التريبس اللي خدها قبل كده مع العقار ده. هنا السلايد دي بتلخص psychological effect of LSD where we can see that LSD causes psychological effects as hallucination, sensory distortion, paranoia, and euphoria. The physical effect can increase the heart rate, increase the body temperature, cause dehydration and sweating. Extreme use بقى أو long-term use can cause psychological addiction. It's not physical here, it's psychological. So your brain is seeking it, not your body. Psychosis, flashback, and depression. The next serotonergic hallucination is DMT. And if any one of you have already watched the movie الفيل الأزرق, where they talked about intaking of DMT. DMT is N-dimethyltryptamine, and we can see its structure on the right side. And again, we are not going to study any chemical structure. DMT by itself is found in many plants and seeds and even in mammalian cells, but it can also be produced synthetically. It is found, as I said, in the mammalian brain, where it is thought to play an important role in thought processing, dreaming, and near-death experiences. So it is not a new compound. No, it is present in a lot around us, in plants, seeds, and even in mammalian brain. It is usually ingested by snorting, smoking, or injection. It is not effective as hallucinogenic by itself. No, we must take MAO inhibitor with it, so it inhibits its mechanism, the concentration increased, and it can cause the hallucinogen effect. يبقى هنا العقار ما بيتاخدش لوحده، دايما بيبقى فيه خلطة من الدي ام تي أو سورس للدي ام تي مع سورس الماو انهبيتور اللي هو مونو امين اوكسيديز انهبيتور، علشان يمنع التكسير بتاع الدي ام تي، يزود الكونسنتريشن بتاعه وبالتالي يعمل الهالوسينوجينيك افكت. هنا التريب it's very short trip, it's very fast acting, very short trip. على عكس ال LSD. Users often report entering a fractal landscape where they interact with entities that often observe, test, or even impart messages to them before they return to their bodies. So the DMT experience is the before death experience. Where patient can experience exiting his own body and watching his own body as a kind of spiritual case. This trip is very short. It only takes 5 to 10 minutes. هنا بنتكلم دايما على تجربة ما قبل الموت، إنه بينفصل عن جسده وبيطلع يراقب نفسه من فوق وبيتفاعل مع حاجات مش موجودة وبيرجع تاني للجسد بتاعه. As it seems, it's not real as it seems that he exit his own body and return again to his own body. Chronic use can cause confusion, agitation, high blood pressure, and loss of muscle coordination, and anxiety. And again, the flashbacks, as I said, is a case associated with most of hallucinogens. بين الدي ام تي المشكلة التعاطي بتاعه إنه بيعمل confusion, agitation، بيرفع ضغط وممكن يعمل تأثير على muscle coordination، وأخطر حاجة زي ما أنا قلت الفلاش باك اللي بتفضل يعاني منها المريض حتى بعد ما بيوقف التعاطي. When you talk about drug abuse, we must mention tolerance and dependence. Tolerance is a diminished responsiveness to the drug action. The drug action, its action, its activity, its effect decrease The same dose cause a decreased effect. So tolerance can be demonstrated by a decreased effect from a constant dose. So today I'm taking 500 paracetamol, so it relieves my headache. After a week, if I am taking 500 milligram of paracetamol, I'm still suffering from the same headache. I must increase my dose to 1 gram or 150 gram to attain the relief of my headache. يبقى التولرنس هنا معناها ان نفس الجرعة اللي انا باخدها مش هتديني الافكت، لازم ازود الجرعة. يبقى الجرعة دي بتديني less effect. لو الجرعة ثابتة الافكت بتاعها بيقل، لازم ارفع الجرعة عشان اخد نفس الافكت. دي معنى كلمة tolerance. Tolerance can be demonstrated by a decreased effect from a constant dose of drug. Or I can express it in another way, so I'm going to say an increase in the minimum drug dose required to produce a given level of effect. I must increase the dose to attain or to achieve or to gain the same effect. Physiological tolerance involves changes in the binding of a drug to the receptor. It is not a psychological, no, the body needs a higher dose to gain the effect. Cross tolerance is the condition where tolerance for one drug produces tolerance for another drug of the same class. If I'm talking about opioids, so cross tolerance can occur between morphine and heroin. If the patient suffers from tolerance to morphine, he's going to suffer also from codeine, fentanyl, heroin, or any other opioid. Cross tolerance is the condition where tolerance for one drug produces tolerance for another drug of the same class. Person who is tolerant to morphine will be also tolerant to the analgesic effect of fentanyl, heroin, and other opioids. المريض اللي بيعاني من التولرنس لدراج هيعاني برضو من نفس التولرنس لنفس الكلاس. What about dependence? Physiological dependence, where your body is dependent on the drug, occurs when the drug is necessary for normal physiological functioning. This is demonstrated by the withdrawal reaction. Your body needs the drug to perform its action. And if the drug is no more here, if the drug is absent, the body will suffer from withdrawal reaction. Withdrawal reaction are usually the opposite of the physiological effect produced by the drug. أعراض الانسحاب تظهر لما المريض يوقف الدرج. ليه؟ علشان الجسم معتمد على الدواء. أول ما بيوقف الدواء الجسم بيشتكي ويبتدي تظهر أعراض الانسحاب. أعراض الانسحاب بتبقى عكس تماما الإفكت بتاع الدرج. إزاي؟ This slide show the acute action of the drug on the left side and totally opposite effect on the right side for the withdrawal effect. As an example, if the drug causes analgesia, so stopping the drug will cause the withdrawal symptoms of pain and irritability. If the drug causes respiratory depression, stopping it can cause hyperventilation. If the drug causes euphoria, then the opposite is going to be dysphoria, relaxation, restlessness, tranquilization, fearfulness, decreased blood pressure, increased blood pressure, constipation, diarrhea, pupillary constriction, pupillary dilation, hypothermia, hyperthermia, drying of secretion, lacrimation, flushed and warm skin, chillness. يبقى كل واحد الإفكت من دول كان الدرج بيسببه، لما المريض بيوقف الدرج هيعاني من أعراض انسحاب عكسها تماما. هل السلايد دي هتتحفظ؟ طبعا لأ، دي بس أنا بوريك كل واحد وعكسه. I'm not going to study this slide. I'm only showing it that the acute action of the drug is the withdrawal symptoms of it is completely the opposite. What are the signs of addiction? How can I tell that the person is an addict? If this person has inability to stop taking the drug, he suffers from increased tolerance, there is an intense focus on the substance or activity, he's always thinking about the drug or using it, he has personal problems and mental health issues. يعني الشخص ده مش قادر يوقف إنه ياخد العقار ده، الجرعة اللي بياخدها بتزيد مع الوقت، دايما مش بيفكر غير بس إن هو يتعاطى وخلاص، عنده طبعا مشاكل سواء على المستوى الشخصي أو مشاكل صحية. الشخص ده ممكن يكون عنده physical dependence. This patient may suffer from physical dependence where the body has been altered in ways that create craving for the drug and manifest withdrawal symptoms. The patient may suffer that the body is always seeking for the drug to perform the action. If the patient stops the drug, he is going to suffer from withdrawal symptoms. On the other side, the mental dependence, individual believes, this is not a fact, just the individual belief that optimal state of well-being is achieved only through the action of drug. So he is related to the drug to be in a good mental state. يعني في فرق بين الفيزيكال والمنتال. الفيزيكال actually الجسم لازم ياخد الدواء علشان يحقق هدف ما في الفسيولوجي بتاعه. ولو المريض ده وقف انه ياخد الدواء هيعاني على طول من اعراض انسحاب. على الجانب الآخر mental dependence يبقى بس هو معتقد أو مصدق إنه محتاج الدوا ده عشان يبقى كويس. لو ما خدش الدوا ده إحساسه فقط مش هيبقى كويس، مش البرفورمانس على الصعيد الفسيولوجي بتاع بادي هيختلف. لا، ده هنا بتكلم على صحته النفسية هي اللي هتتأثر بعدم وجود الدراج. إزاي أقدر أعالج الإدمان؟ ممكن يبقى treatment of addiction can be hospitalized. The patient can be hospitalized because certain substances can create withdrawal symptoms that are very dangerous to their body. We must here take it as an intake as an inpatient in the hospital. يعني لازم يتحجز في المستشفى علشان أعراض الانسحاب قوية ما يقدرش إن هو يتغلب عليها لوحده. Or the patient can be in a rehab facility where the addicts may live at a rehab, inpatient rehab, or visit for a scheduled session. يعني ممكن نعالجه في facility زي مثلا مركز أو حاجة زي كده لعلاج الإدمان. ممكن يتحجز جوه أو ممكن إن هو يروح بريجولار بيزس زيارة واحدة في الأسبوع، مرتين، على حسب ما الطبيب أو الجروب أو الكرو المعالج ده بيحدد. Then medications, yes, we can use some medications. Certain medications can reduce urges, craving, and ongoing withdrawal symptoms. But actually, the situation in Egypt that they don't use antagonist or agonist or something like that. They just may use OTC drugs or prescription drug to alleviate the withdrawal symptoms. They don't use chemical resemblant drug. يعني مثلا في البروتوكول بره ممكن استخدم بيثيدين او حاجه زي او ميثادون او كلام زي ده اللي هو بيشابه الاوبيويدز عشان يبقى الافكت بتاعه اقل، لكن ستيل برضو it can risk the addiction. او في حاجات تانية اسمها antagonist اللي بيخش يقفل الريسبتور تماما بتاع الدراج. في مصر ما عندناش البروتوكول ده غالبا، لا بيسيبوا البيشنت ان هو بس مجرد يمانج الويذرول سيمتومز وما بياخدش اي حاجه من دول خوفا من ان البيشنت يقع تاني في دائره الادمان. So in Egypt, we are not using the antagonist or agonist theories. No, we are just managing the withdrawal symptoms by simple medicine. Again, the line of treatment can include CBT, which is cognitive behavior therapy, or support group, where the patient is treated with similar patients, and they talk about their experience with an experienced person who can guide them or teach them the behavior methods or protocol to how to be again not dependent on the drug. يبقى السي بي تي ده نوع من انواع معالجة النفس أو بيديك بروتوكول إزاي أنت تقدر تقول لنفسك أنا هقدر أبطل. بيعرفك إزاي تقدر إن أنت ما تقوي إرادتك وما تخشش تاني في الدايرة دي. طب why do people أصلا consume drugs? Sometimes there is a family of substance abuse, maybe a father or a partner or a brother or even a friend is consuming drugs. The second cause is mental or behavioral health conditions such as depression. A person may feel that he like to isolate from the society or the community. He cannot live with others. He suffers from communication with other people. So he choose to isolate from them via consuming these drugs that isolate him from the reality into a virtual world where he can feel safe and um, well-being. يعني هو ممكن يكون في تاريخ في العيلة نفسها أو في الأصدقاء، أصدقاء السوء زي ما بيقولوا، أو عيلة أو شاف أب أو أم أو أخ بيتعاطى فبيحب يقلد زيه. ممكن يبقى عنده حالة نفسية مش قادر يتعامل مع المجتمع، حاسس إن في مثلا خيانة، فقدان ثقة، ناس كتير وحشين حواليه، فبيحب إنه ينعزل عن العالم ده ويخش في عالم افتراضي هو اللي عامله بنفسه. العالم ده بيبقى حاسس فيه إنه مطمن أحسن، رافض القسوة اللي موجودة في العالم الحقيقي. Third reason is impulsive or risk-taking behavior. يعني he likes to try, he likes to enter a new experiment. Let's see what can happen. يعني بيحاول يجرب دايما، عايز يشوف ايه اللي هيحصل. These person usually take risk in many things, not only drugs. They may drive their car very fast, or they may try the very dangerous games. Fourth reason is a history of traumatic events, such as experiencing a car accident or being a victim or abused, whether it is sexually abused or he got hit by a parent or by a partner. يعني بيبقى فيه تاريخ لتروما أو صدمة كبيرة حصلت للشخص ده، سواء مثلا حصل له car accident أو تجربة قاسية جدا عليه. history of abuse، سواء كان الابيوز ده تحرش أو حد من مثلا الأب أو الأم أو البارتنر، الزوج أو الزوجة كان بيهينه أو بيضربه أو حاجة زي كده، فبيبقى شخص ضعيف أو شخص نفسه إن هو ينسى الحادثة أو ينسى الحاجة الفظيعة اللي تعرض لها ده عن طريق إن هو يخش في الفيرتشوال وورلد. And finally, the low self-esteem or feeling of social rejection. Again, as I said, he is going to create his own virtual world where he can feel safe and well-being. How can I help someone with an addiction? I always speak up sooner than rather than later. يعني بواجه الشخص ده أو بتكلم مع عيلته أو بتصرف بسرعة، ما استناش إن هو يخش deeper and deeper into this circle. Practice empathy. Even when you don't agree with your loved one, just listen thoughtfully to them. Don't try to refuse, don't try to yell, don't try to point fingers at them. Just try to listen and be passionate as long as you can, even if you don't approve their action. Be patient. It requires a lot of time to get out of this circle. And don't forget to take care of yourself, because your mental health counts. If you're not going to take care of yourself, you'll not be able to take care of someone else. هنا بنقول إن إحنا لازم نتصرف أول ما نحس إن الشخص ده بدأ يدخل في جدارة الإدمان، لأن ممكن أسحبه من بدري، لكن once إن رجله جت في الخية و deeper and deeper and deeper هيبقى صعب أوي 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 إنه يطلع منها. الشخص ده محتاج دايما إن أنا أتعاطف، أسمع، مش أزعق. ما ينفعش أزعق، ما ينفعش ألوم، ما ينفعش أقول لك ما أنا قلت لك. الإحساس ده هيخليه على طول يرفضك وهيرفض مساعدتك. الصبر، لأن الموضوع طويل قوي، ما بينتهيش في يوم في ساعة، لا ده بياخد شهور وسنين عشان يرجع تاني زي الأول. ما انساش بقى في التجربة الطويلة دي إن أنا أعتني بنفسي. لو أنا مش هقدر أعتني بنفسي مش هقدر أعتني بحد تاني. إزاي ما أقعش في الدايرة دي؟ How to be protected. Always avoid temptation and triggers. If I'm a person who likes to experience new experiment, just don't go into societies or areas where you know quite well that they consume drugs. Get to know your risk factors. If I am a person, I'm a weak person, I cannot say no to my friends, so I'm not going out with them because I know they consume drugs. يعني لو أنا ضعيف قدام أصحابي ما بحاولش أخرج معاهم وأنا عارف إن هم بيتعاطوا، لأن هم هيفرضوا عليا الحكاية دي. If I'm sad, if I am easily depressed, So لازم أتصرف. I must seek professional help. Maintain healthy balance in life. يعني ما ينفعش إن أفضل أذاكر طول الوقت، وما ينفعش إن أنا أفضل ألعب طول الوقت، ولا إن أنا أفضل منعزلة عن العالم، ولا إن أنا أفضل مع أصحابي طول الوقت. No, it's a matter of balance between everything in my life, between the study time, the going out time, uh, plan, hope, and dream. It is very, very important to always plan ahead, the short plans and the long ones. For example, I have an exam coming in a month, so I'm going to put a schedule for my study. This is a short-term plan. A long-term one, and what I'm going to do in summer vacation, what I'm going to do with my career, how am I going to plan to be a good dentist, a good pharmacist, or whatever. Hope, I'm always on the positive side, positive energy. And dream, it is always good to have dreams, a lot of ones, even if just small ones. I like to travel. I dream about having a nice home, whatever. If even I dream about finishing level number 9 in whatever games. Short dreams, small dreams, big dreams. Dreaming is always good. يبقى أنا عشان أتجنب إن أنا أدخل دايرة الإدمان، لازم إن أنا أتجنب الtemptation. لو أنا عارف إن أنا من الناس اللي باخد الrisk، باحب أجرّب حاجات جديدة، ما احاولش إن أنا أروح في الأماكن اللي بيبقى فيها الحاجات دي، ولا مع الناس اللي بتتعاطى الحاجات دي، لأن عارف إن أنا هاجرّب. لو أنا ضعيف برضه قصاد أصحابي ما اخرجش معاهم. لو أنا من النوع بازعل بسرعة، باكتئب بسرعة، ما احاولش برضه أقرّب ناحية الdrugs دي، لأن دي هتريحني temporarily، فما احاولش إن أقرّب منهم. دايمًا أخلّي عندي اتزان في كل حاجة باعملها في حياتي. ما اذاكرش كتير أوي وأنسى الفُسحة، ما اتفسحش كتير أوي وأنسى المذاكرة، عشان برضه هارجع في الآخر أدائي مش هيبقى على المستوى الحلو، فهازعل، ولمّا أزعل ممكن أبقى عايز أنسى الزعل. لازم رياضة في حياتي برضه مهمة جدًا. هوايات، ما انساش نفسي إن أنا أخرج بس، أو مع أصحاب بس، أقرا، أعزف موسيقى، إن شاء الله حتى ألوِّن. دايمًا plan hope and dream. أحط خطط مستقبلية، سواء كانت المستقبل ده الweekend هاعمل فيه إيه، أو الامتحانات هاعمل فيها إيه، أو إجازة الصيف هاسافر فين. دايمًا يبقى عندي آمال حلوة، أنا هابقى حاجة حلوة، هابقى هاحقق حاجات كتير في حياتي، حتى لو very small achievements quite achievement. أحلم. الحلم عمره ما بيزعّل في حاجة، سواء كانت أحلام صغيرة، حتى لو level هاعدّيه في لعبة، برضه it's good إن أنا أحلم بحاجة زي كده. وربنا يحفظ الجميع من كل سوء. Thank you for your attention.